My name is Dr. Raj Shekhawat. I'm an associate professor in audiology at Ear Institute, UCL. Now, I have been invited to give 2 guest lectures to you on 30th Jan and 6th February. And over these 2 lectures, we'll be covering few important topics for you. First of all, we'll be learning more about hearing assessment. What is a hearing assessment, specifically pure tone audiometry? How to do a hearing assessment, how to interpret an audiogram. What are the various types of hearing loss, degrees of hearing loss? Then we'll be moving on to understanding a little bit more about tympanometry and acoustic reflexes. Now, important question for us to think about is, why exactly do you need to know all these things? Well, that's something for you to reflect. That's a task for you. And secondly, in terms of your reading, I don't want you to do any reading. I just want you to relax and come to the lecture with open mind and open heart. We'll be doing series of activities and lots of interactive things in the lecture so that you strengthen your learning around all these concepts. The only thing I want you to do is I want you to reflect on 2 things. First, why as a speech therapy students you must know these concepts in audiology. All right? And the second thing is, in your day-to-day life, if you were to have, say, a severe to profound degree of hearing loss, how will that changes or how will that influence your everyday living activities, starting from the moment you get up from the bed using an alarm clock all the way to the time you go back to the bed? How it'll affect your personal life, professional life, social life, family life, all of that. Have a reflection of that, okay? And I'll be looking forward to seeing you on 30th Jan and 6th February to strengthen our concepts about hearing assessment, tympanometry, and acoustic reflexes. Thank you so much. Bye.